Hi, my name is Hiroko Kiyoshi-Teo. I'm assistant professor at School of Nursing. I wear two hats here. First hat is to be teaching. I mainly teach undergraduate students in their nursing fundamentals course, health promotion and acute care nursing. And my second hat is doing research. What I love about working here at OHSU is the enthusiasm that students have in terms of learning, especially in their sophomore year. They're a little bit anxious, but so eager to learn, and it's really fun to introduce them to the world of nursing and then to be part of their journey to become a nurse. That's really exciting for me. I also love the energy and motivation that faculty has in terms of teaching. We're always striving to do better, teach better, use evidence-based methods, talk about it. I love that. It's a very collegial atmosphere, and I really thrive in that kind of environment. So I'd like to share that I'm actually trained in nursing in Japan. So that was, 15, 16 years ago now. But I had basic nursing training in Japan, in Tokyo, and worked as a nurse before coming to the US for a graduate program. And I started off being an international student, so I understand how difficult it could be, not only with language, but with culture and different academic cultures. Like, oftentimes in Asian countries, students don't question their professors. But here, students are encouraged to ask questions. And when I became a faculty, it was just such a switch for me to be accepting and then to know how to interact in that terms. And when I was also a graduate student, I had to really force myself to be more outspoken in class. So I told myself every class, my English wasn't as good, but I would say in every class I would ask a question or raise my hand at least once. And that got me going, and by the end of 7 years in the graduate school, I was pretty much more of the outspoken student in the class. So my research work, I've been doing research on patient safety for about 8 years now. My original work started from looking for ways how nurses could prevent hospital-acquired infections, especially in ICU setting, and also related to urinary catheters and also peripheral IV lines. And my research explored how nurses could be more powerful, empowered, and have more impact into preventing hospital-acquired infections. That has evolved into studying fall prevention in a hospital setting. How can we prevent more falls of inpatients? Because it's an ongoing topic. It's been studied for decades, but we're still haven't found the magic bullet, and there is no magic bullet. But what I'm proposing right now with my research studies is looking at it from a slightly different perspective, looking at fall prevention rather than using checklists and reminders and instructional education. My research focuses on how we can facilitate patients' behavior change. Because fall prevention, it actually comprises of multiple behaviors that patient need to start doing something differently. Even wearing different kind of socks or using the cane, even using the call light before they get up. It's a change for the patient. And my research for now uses a motivational interviewing technique, a certain way of talking to patient and partnering with patient. We're trying to see if that has an impact on reducing fall-related behaviors and rates of falls. I've been impressed how OHSU has been very inclusive of different types of background for faculty and also for students. So, being from different country and different background. I feel very welcome here. We can certainly work on more diversity, and we're trying really hard through the admission process and whatnot. And I also really appreciate the fact that diversity is not limited to just cultural or ethnicity, but also very inclusive of different sexual orientation, and faculty are working really hard to address different types of gender identification and the spectrum of expression of ourselves, and I really appreciate that about this school.